I want to tell you a story of a woman around 17 or 18 years old, starts to notice her hair is falling out. It's not falling out in big clumps, it's sort of thinning all over. She's noticing more hair in the shower in the mornings. She's noticing more hair in her brush, more hair on the floor in the bathroom. She goes to her medical doctor, explains what's going on. They ask very few questions, run a pregnancy test, and send her on her way. A few weeks later, she goes back again and says, "Look, my hair is falling out. I'm really scared. It's impacting how she feels about herself, her sense of confidence. She's worried that something serious is going on." But they just dismiss her again and again. That woman was me. When I was in my late teens, finishing high school, getting ready to go off to university with dreams of becoming a doctor, my hair was falling out. It was thinning so much. I was so concerned. But because I always had really thick, full hair, not everyone could see the hair loss the way that I could. And so it wasn't taken very seriously by my doctor. Ultimately, we did determine that the cause of my hair loss was an iron deficiency, as well as pretty significant stress that I was under at the time. And when I really worked on correcting those imbalances, my hair did come back, and I have fantastic, lovely red hair to this day. I tell you this story because I want to share with other women. I want you to understand that hair loss can be a significant symptom of something deeper inside. That it's not just something that we should accept as we get older, that it is a symptom of our body trying to communicate with us, to tell us something is going on. In this video, I'm going to talk about the 5 key hormones that I look at when I'm trying to understand women's hair loss. Hormones are not the only picture, and I do encourage you to look at some of my other articles on my blog, which I'll link to below, on hair loss. Things like the essential tests for hair loss and getting to the root cause of hair loss for women. But in this video, I'm just going to talk about the hormonal aspects. When we talk about the hormonal concerns around hair loss, the first thing that I want to look at is your thyroid. It's a small but mighty gland located in your neck, and it's usually thought of as being essential for energy production. But energy production is a lot more than that fire we have in our bodies. It really is a cellular process that allows us to make everything in our bodies. When you make too little thyroid hormone or hypothyroidism, then hair loss can be a very common consequence of that. Additionally, if your hypothyroidism is autoimmune or Hashimoto's thyroiditis, then a condition called alopecia areata is a lot more common. That type of hair loss causes small circular patches of hair loss and can actually lead to pretty significant hair loss on the scalp. If you're experiencing those small circular patches, you definitely need to be assessed by your doctor and be sure to have all of your antibodies looked at for your thyroid and other autoimmune antibodies as well. The next hormone that we look at when we look at hair loss is testosterone. Not surprisingly, testosterone can absolutely impact hair loss in both men and women. When we have excessive amounts of testosterone, or actually the metabolite of testosterone, dihydrotestosterone, we can experience hair loss either all over our scalp or often in what's kind of like a U-shaped pattern where there's more hair loss at the anterior hairline as well as at the vertex or the top of the scalp. This type of hair loss is often common in women who have high levels of testosterone, such as women who have like PCOS or irregular periods. So if your periods are not coming as often as you think that they should be every 28 to 30 days, or if you have significant acne, particularly in your beard distribution, or you're experiencing hair loss, please get a testosterone level done, and if not testosterone alone, also a DHT level. On the flip side of the testosterone issue is women who have low progesterone. Progesterone is a really balancing hormone. It helps to balance both estrogen in our bodies, but also testosterone. Progesterone and testosterone, the molecules are very similar, so they do actually share some receptors, and our hair follicles have these shared receptors. So when your progesterone levels are low, such as women through our 40s or postmenopausal women, that testosterone that we have can then bind to those receptors unopposed. Nothing's arguing with them, nothing's competing for those spaces. And we can end up having testosterone like hair loss, even with totally normal testosterone levels. Whenever we're looking at hormones, we're looking at balance, not absolute levels. So this low progesterone can be a pretty significant concern. Women who are on the birth control pill who experience hair loss often have this particular type of hair loss as well. Because when you're on the birth control pill, you don't make progesterone. Progesterone is made after we ovulate, and you don't ovulate when you're on the pill. So if you're experiencing hair loss on the pill, this might be your problem. Another hormone we want to look at is insulin and our blood sugar stability. Insulin is a hormone produced by our pancreas that allows us to move sugar out of our bloodstream and into our cells. When we consume a diet that's really high in refined grains like bagels and pizza and bread and pasta, or high in just sugar, our blood sugar levels get too high and our insulin levels get high as well in order to try and get those cells to take on the sugar. Eventually, our cells just don't need any more sugar and they stop responding to insulin, which causes insulin resistance. This insulin resistance in women can then cause our ovaries to not respond appropriately to hormones as well, which can cause them to produce higher levels of testosterone and DHT. And again, we're in that same scenario of having that testosterone-driven hair loss. The final hormonal imbalance I want to talk today about is stress and cortisol. We know that stress can cause hair loss. It's something that a lot of women have experienced, myself included. Stress can cause high or low levels of a hormone called cortisol, both of which can contribute to hair loss. People who are in a state of stress overwhelm or even stress burnout can both experience hair loss because that stress hormone will cause more of your hair to enter into what's known as the telogen or hair fall phase. When we look at addressing stress, we really can help to turn this around quickly, and most of the hair loss associated with this can be reversible. Understanding the hormonal causes of hair loss for women is just the first step. To get to the root cause of hair loss, comprehensive testing is almost always necessary. The problem is that many doctors just don't take hair loss seriously. I know that from my personal experience. In some cases, you may need to pay out of pocket to get this level of testing, but in the end, you'll have the knowledge that you need to put an end to your hair loss and allow you to regain not only your healthy hair, but get your hormones back in balance and regain your quality of life. If you have any questions, please don't hesitate to get in touch with me. I would love to talk to you about my approach to managing hair loss, my personal story and experience with hair loss, or connect you with a naturopathic doctor in your area who can help you to achieve your hormone balance and get your hair back to being as healthy as it can be.